28-year-old man in Oklahoma suffered a stroke after popping his neck. Josh Hader says he heard the pop and everything on his left side started to go numb. He had trouble walking straight and was rushed to the hospital where he was diagnosed with a stroke. Doctors say the stroke wasn't significant, but it did cause a lot of damage. Hader suffered from double vision and blurry vision, forcing him to temporarily wear an eye patch. He has since made big progress in his recovery.
Meanwhile, a 23-year-old woman in England had a similar experience this year. She's a paramedic and she had a stroke when she cracked her neck, but first thought that she was just drunk. She heard a crack when stretching her neck while in bed after a night out. She was taken to the hospital where she was told a vertebral artery had burst and a blood clot had formed in her brain. So you may or may not have seen this next story, but these stories that we've been telling you about. But it is scary to think that you could give yourself a stroke by just cracking your neck.
So we had to learn more about this.
Yes.
So that's where medical reporter Rosemarie Beltz comes in. And Rose, how can this happen?
Right? Because just watching around the newsroom, how many we stretch, we crack our neck. People are probably doing it now. Occupational hazard, we have a lot of pain, right, as we get older. Yeah. So before we go into that, I'm going to explain it. I really want to just show a little bit of anatomy so viewers understand like what they're actually looking at. So right here, you can see the head and the neck. So here's what we're typically looking at, and this is what looks, what we look like basically on the inside. The head and neck, a pretty busy supply of arteries that are supplying oxygen to our brain. We have the four main ones. We have our two carotid arteries, and we have our vertebral arteries, and then we have our spinal artery that we cannot see here. But basically these two arteries are, like I said, supplying our head of oxygen. Now, the vertebral artery, which happened in this case with this gentleman, this 28-year-old gentleman. So basically what had happened was, on his own, he was uncomfortable. It sounds like over a period of a couple of weeks, just stretching, added a little, clearly too much pressure, and he tore this artery here, one of these two arteries here. Now, when we say something like aortic dissection, it can be a little bit confusing. And basically, really, all that means is our arteries have three layers. He tore the inner layer of that artery. Yes.
How easy is that to happen?
So, okay, so these types of strokes, they're not common, but common, right? So stroke is common, but these typical types of strokes, less than 2% of the population. However, they're more common in young people. And how that actually happens is any sort of blunt trauma, whether you're in a car accident, sports injuries, and in this case, chiropractic manipulation or manipulating your neck. So which is why you shouldn't do this on your own.
You need to go to a real chiropractor who is trained in aligning your body and adjustments and manipulation.
Exactly. And also, to be clear too, is that you really, because there's a lot of, we're not really sure who's working on us. So you want to make sure someone's licensed. Also, so for some people with insurance who a chiropractor might not cover, you go to a medical doctor as well to get a proper exam. You just want to make sure you have images, because as you can see, there's a lot going on in this picture. So we really don't know what we're manipulating. And a lot of people, I'm sure, out there are not thinking about their internal anatomy when you're doing something like this.
So what are some signs, if we're cracking our necks, what are some signs that we may be in trouble here?
Sure. Again, so I think a lot of people I don't want people to worry, but this can happen. Signs of a stroke, which are vertigo, basically dizzy, slurred speech, extreme pain. Some of this can be very non-specific, but another thing too, these symptoms might occur right away, but they also might take weeks, right? So you kind of have to keep track of what you were doing when you were doing it, because it might not show up right away. But the key thing with a vertebral dissection is that you might hear a swooshing sound. You actually hear like a swooshing sound that could be really like this annoying, like, oh, what is that sound? I can't get rid of it. So that's kind of a key indicator for these types of strokes.
Yeah, I know when we started talking about this story, the first thing I did was call my chiropractor, send him a text
Right.
message, Dr. McCon, and I'm like, wait, what? And he said the occurrences of this happening, if you're working with a good chiropractor, a licensed physician, are even less than in the general public having a stroke.
Right. And we all do these manipulations, but the key is it's probably not a good idea. If you have these symptoms, act quickly, don't wait, because your treatment and your recovery is going to depend on how fast you act on those symptoms, which could be, life-threatening or, your nerve damage. Like that could all be resolved the sooner you act.
I know so many of us in the newsroom are like, who already crack our necks are really being conscious about it.
I'd pay someone to crack my neck. I don't do it on my own.
Right. There's a right way to do everything, right?
Right.
Yeah.
Rosemarie.
All right, stay with us. Coming up after the break, Chief Meteorologist Jim Gandy is going to have a look at your forecast. We've got clouds overhead this afternoon, and it looks like there may be some rain in the forecast for this weekend.